I think that's the perfect music to get anatomic with Janice Ying here on Drumming Injury Talk. But it's not just for drummers, right, Janice? It's anybody with repetitive motion injuries.
It's for all humans, really.
All humans, really, yes. Yes, that's true. And if you're a musician, you probably have repetitive motions, whether it's drumming, whether it's valves on a wind instrument, doing this, right? So we're going to get anatomic, and Janice is going to show us some things in the anatomy to help us understand what causes at least one injury in particular, carpal tunnel, what it looks like, why it hurts, how to fix it or get it fixed. You probably don't want to get a coat hanger and fix it yourself, right, Janice?
Probably not advisable. At least it didn't come from me if you do that.
Sterilize it, though, if you do. Try that.
Yeah. Right. Step one.
So where would you like to begin?
Well, I mean, it's like one of those things is like, it doesn't matter like what you do. If you're an instrumentalist, you play the drums, you play the flute, you play the violin, you run a marathon, you sit on a couch, like the human body is the human body. So, we all have the same anatomy. It's just what we do with it is different. Right. So, one of those conditions, that people always are fearful of getting, or, if they have any pain in their hands or anything, they automatically, oh my gosh, I have carpal tunnel. That's like always like the first go-to.
Really? That's the go-to self-diagnosis?
Yeah, and which it's not always carpal tunnel. I'll just say that. And we can maybe like dive into what that might mean and all that stuff. But carpal tunnel is basically, so you have a bunch of nerves that, like the nerves in our body, obviously have our brain, we have our spinal cord, and then like from every level of our spine, we have nerves that kind of shoot out. But you have three major nerves that go into the arm, right? So you have your ulnar nerve, you have your radial nerve, and then you have the median nerve. You have other ones, like smaller ones as well. But those are kind of like the three like super highways that I like to like call it. Those are like the major ones. And then you have like kind of branches from those that kind of go into different areas. So where someone feels numbness, tingling, weakness can be very indicative of where that nerve is getting compressed. And
should I pull up the diagram?
Yeah, let's do it. Oh, how funny. So so this is the body, right? So if we start from the very top, and we zoom in, maybe we'll take some nerves or some muscles away. Let's see. Okay. So if we zoom in, you can see from the spine. So the white part here is the spine. The red is the muscle, and the yellow are nerves. Okay. So I kind of cleaned this picture up for you guys a little bit. But from every level of the spine, you can kind of see like one nerve kind of like shooting out from the spine. So this is like coming from the spinal cord, it exits the spine. And then as we get a little further out away from the spine, you can see kind of how they like kind of join together to make bigger nerves. And so these are where like those major nerves kind of come from, is a combination of different levels from the spine. So the median nerve, sometimes it takes a little bit of precision for me to get it right the first time. Nope. The median nerve is this guy. If we go a little bit. Okay, so the median nerve is the one highlighted in pink. So you can kind of see, let's take some stuff away again. Fade. So it kind of dives a little bit deep. So it goes underneath like your biceps and like those muscles on top of your arm. Travels down the arm, and then it goes into the hand. I keep doing the wrong branch. Go a little higher. So the median nerve, as you go into the pink, right? It goes down the arm, and then if it's true carpal tunnel, this is the carpal tunnel. This is the area where the carpal tunnel is. So carpal tunnel syndrome describes a compression of this median nerve at the level of the carpal tunnel. Now, you can see that the path of this median nerve is quite long, right? And so it starts all the way from the neck.
Yeah.
It can travel under the shoulder over here or in front of the shoulder and goes all the way down. So really, at any point along this pathway, the median nerve can get stuck. And if it gets stuck or compressed, that can cause symptoms in the pattern of the median nerve. So that's usually the thumb, the index finger, the middle finger, and then half of the ring finger here. So
Hmm.
that's just the median nerve. But if it gets stuck at other portions of that nerve, that's not carpal tunnel syndrome. The only time where it gets where it is true carpal tunnel syndrome is when it gets stuck or restricted right here at the wrist.
And it's literally a tunnel, right? Like a
It
channel?
is.
Yeah.
Yeah, so if we turn it a little bit, so if we zoop like this, and maybe we add in a couple layers of the wrist here. Okay, and then we zoom in a little bit more. So the tunnel
Oh,
is
yeah.
literally this tunnel, the space. Whoops,
Hmm.
sorry. The space right in through here.
And is
So
the
that
compression due to inflammation that
it
pushes on the nerve?
it can be. So in this tunnel, let me see if I can get a good angle of it. In this tunnel, you actually have, so there's this covering here. This is called the flexor retinaculum. So that's the ceiling of this tunnel. And the floor of the tunnel is like the bones, the wrist bones. Within this tunnel, within this structure, you actually have, let me just hide some stuff so you can see it a little bit better. You actually have a bunch of tendons going through the tunnel. You see
Hmm.
that? As
Yeah.
well as the median nerve. So if there was swelling, and this could be swelling, like people who are pregnant, women who are pregnant actually get a lot of swelling in their hands and feet. And so carpal tunnel is actually a really common thing for that to happen because this is a very small space. Really, it's about the diameter of your thumb for all of these structures, all of these 9 structures to pass through.
Oh, wow.
So it's a very, very small space. And so if you have swelling, maybe you have tendonitis in this area, and tendonitis causes inflammation. So if there's fluid in this area, that can also add to pressure on the nerve, right? Or if you like to rest your hands on the desk,
Mm.
and like kind of put pressure on it that way, that can also cause, potentially cause some compression of the nerve. So anytime a nerve is compressed or overstretched, that's when people can get symptoms um, throughout the nerve. So nerve symptoms are usually like numbness, tingling, sometimes weakness because they communicate what our brain tells us to the muscles that it affects.
Right.
So that's really what the carpal tunnel syndrome is all about.
And how is it typically aggravated or brought on by drumming? I mean, is that kind of a no-brainer? It's just the repetitive motion, it's impact. Impact can often equal swelling, and that puts pressure on the nerve in the
So
tunnel. Is that what causes it?
yeah, so this it's interesting. It's kind of like multifactorial, particularly if it comes to drummers or people who even like work in industrial settings.
Mhm.
So of course it's like the repetitive motion, right? You think about when our wrist moves, the tendons need to glide and slide well throughout that tunnel over and over and over again. So it
Mhm.
could very much be the repetition of it. It could be that the nerve just isn't moving well in general. So nerves are different than muscle in the sense that they don't have as much elasticity in the tissue.
Yeah.
Nerves are more like a power cord where there's maybe a tiny bit of give, but really when they move, they kind of like slide and glide through our
Yeah.
tissues. Um, but the other thing too that is unique about drummers is the vibration that goes through our hands.
Right.
Um, and so there can actually be nerve damage with repetitive or prolonged exposure to vibration in the hands. And that can actually affect nerve performance or nerve health. So there's that perspective as well, that whereas like a lot of other instrumentalists don't have that kind of vibration that the body has to kind of absorb or kind of take up in that area.
So how, adding to that, how much does the effects of being pregnant add to that? And I have to ask because Danielle on our team is pregnant and she's a drummer.
Yeah, yeah. So
Is she more susceptible because of that? I mean, is it kind of an obvious question or not?
not necessarily.
Okay.
It kind of like it doesn't necessarily mean that all pregnant women will have swelling in their hands and feet. Like that's like when I was pregnant, I had carpal tunnel symptoms, but it was like only at night, like when I was sleeping. But
Oh,
like during
word.
the day, I didn't really have anything. I didn't have much swelling in my feet either. So like, it's kind of dependent on the person and then also dependent on the pregnancy too. Because I know some people who have like completely opposite reactions or side effects from different
Yeah,
pregnancies, and it's the same
absolutely.
person, right? So it's kind of a crapshoot when it comes down to that. But people who are pregnant can have higher rates of swelling in their hands and feet, which could
Mhm.
lead to more compression of the nerve in that sense.
Interesting. And how is
Yeah.
it cured? How is it relieved? And what are the, once it's relieved, does that make it more susceptible or none either way for it to be reoccurring? Because I know
Not
that
nec-
sometimes,
yeah.
a fix could also lead to it being more susceptible, but it fixes it at that time. How does this factor in?
It doesn't always mean that, like, if someone has carpal tunnel syndrome, that they're gonna be more susceptible in the future. Like,
Okay.
it's not always a direct correlation. However, the thing that I always say is, like, you need to make sure that you're addressing the true source of where the symptoms are coming from in order to make the problem go away. So, I kinda alluded to this earlier where people can get if you only have symptoms in your hand, um, then the carpal tunnel syndrome could be what is the problem. And
Yeah.
if it's only compression at this area in your wrist, it could be, and you do the right treatments to address that swelling there, that a lot of the times will solve the issue. Sometimes, if we follow the path of the nerve, so if we kind of travel a little bit higher,
Yeah.
sometimes this nerve can get stuck underneath this muscle right here
Mhm.
called the pronator teres, where it
Right
kind
in
of
the
like,
bend of the elbow, right?
yeah, kind of like right at the crook of your elbow here, a
Yeah.
little bit on the like the far end of the elbow, like right past the elbow.
Mhm.
Sometimes the nerve can get stuck up there, which someone will also feel the same numbness and tingling in the arm,
Mm.
but instead of just like contracting their hands and getting pain that way, if they do any kind of twisting motion, that also might exacerbate
Mm.
the symptoms too.
And geez,
So
that could be scary if it's in your left arm, because if it's tingling, you might be worried it's something else,
right,
cardiac
and then
related.
again, right. Usually that's a little bit different. But yeah, of course. But you keep on following the nerve up. Sometimes people can get like nerve kind of stuck in the biceps area. That's another area. So, and you just keep on following up. So along path, any point along the path of the nerve, the most common places to get stuck would be coming from the neck, coming from this area here called the thoracic outlet, coming from the pronator teres or the carpal tunnel. So, kind of working with someone who's able to help you tease out where that's coming from is really going to be the most effective way of making sure that, once you address the symptoms, it stays gone.
Mm.
Um, because, maybe some of the symptoms are coming from the carpal tunnel, but maybe part of it, maybe 30% is coming from higher up in the neck or in the chest. So
Mm.
you could always have some kind of residual effects, or residual symptoms and not completely gone unless you're also addressing what's happening up here too. Um,
Interesting.
so common commonly, if someone were to come see me in the clinic, um, it would be, doing some like massage in the area, trying to make sure that the nerve is able to move well.
Oh.
If there's swelling in the area, trying to make sure that the swelling is kind of addressed. Why is it swelling? What's the cause of the swelling? To help move that along. And then finally, just making sure that the nerve is moving well in general. So, like a good quick test that you can do for yourself to see like how well your nerve is moving is to do like a quick stretch. So, if you like put your arm in front of you this way, and then you bring your wrist back, and then you bring your arm out to the side. If you start to feel any kind of like pulling or tingling at any point along the
Yeah.
path, if you're able to get all the way out to the side with your wrist and fingers fully extended, then
Yeah.
you don't have much tension in the nerve. But if you start to feel any kind of the tension or kind of like pulling sensation
Mhm.
before that point,
That's
then
a
you
sign.
might have a little bit of tension. Now, it doesn't mean that you're going to have carpal tunnel. That's not like a direct correlation, but
Okay.
it just kind of shows that the nerve could stand to use a little bit more mobility in general.
How interesting. And how is it cured? It's typically the way you do it, you mentioned, is with massage. I know some people who have had surgery. Is that old fashioned or does it have to just be really bad?
I always look at surgery as kind of like the last resort, right?
Okay.
I'm in the camp. I mean, obviously, I'm a physical therapist, so like I always like the conservative approach first. Let's see if we can get this gone before we do something invasive to your body, and like so oftentimes like if someone needs to get surgery, it's either that it was something emergent where, suddenly they lost strength in their hand. They need to
Mm.
like get in there right away kind of thing. Um, but usually like the carpal tunnel release, yeah, I honestly haven't seen it quite as often these days. I feel like the trend in general is to try PT or physical therapy or occupational therapy first before
Mhm.
we kind of go down that path.
Interesting. Looking at the points of susceptibility that you pointed out, I'm
Mhm.
surprised that I've never had it that I know of. I'm
Yeah,
surprised I don't hear from so many other drummers that have had it. And if you're watching and you've had it or you have questions, chime in. I'll check the comments in a moment. But it just seems like even people who, like you said, an industrial setting or um, people who work with their hands a lot, roofers and things like that,
yeah, right.
but also like weightlifters and whatnot. I just listened to one of Arnold Schwarzenegger's books and, just thinking of what goes on with all
Yep,
those points, the wrist, the bend of the elbow, under the bicep. I'm
yep.
just surprised it's not more common than I am under the
It's
impression that it's
actually
not.
probably more common in computer desk workers, people who sit in
How
front of the computer
interesting.
all the time.
Huh.
Yeah, I usually see it more commonly in like true carpal tunnel is because like especially on the mousing hand because people are doing kind of fine motor movements and
Yeah.
they're only moving from the wrist, right? They're not using like their whole arm to, you know, do clicking around or anything like
Yeah.
that. So, that's usually where I see a lot of the carpal tunnel cases or like the true carpal tunnel cases. But more times often than not, it usually is coming also from higher up. Very rarely have I seen it only be at the wrist and only at the wrist.
Oh, interesting.
Yeah.
So a bad neck posture or a
Yeah,
neck
so you think about
injury,
that like
muscle
forward
spasm.
head posture that we've been talking about a lot, like in these
Yeah.
conversations.
Yeah.
That can also pinch those nerves that kind of join
Hmm.
together to make the median nerve as well. So,
How
yeah.
interesting.
Mhm.
How many cases do you see amongst musicians? And I know you treat musicians that play many different instruments and whatnot.
Yeah. How many case I mean,
Like what percentage of your work is carpal tunnel that you notice?
like
Any idea?
true carpal tunnel?
Yeah.
Actually not a huge amount. Like I
Well,
said,
that's good to hear. Yeah.
most of the time it's actually coming from the neck or like kind of this chest area, is what I usually see.
Mm,
Even though they might have symptoms into the hand, like carpal tunnel because the median nerve would be affected.
yeah.
But yeah, more times often than not, it's more coming from higher up. And that's
Very
the one thing
interesting.
I'll say, like, those people who end up exploring the option of, carpal tunnel release or the surgery to kind of help address that, is
Mhm.
make sure that they're doing tests, to make sure that it's not coming from higher up.
Right. Otherwise, you're
Eh
just treating the effect and not the cause.
Yeah, I mean, I've had patients in the past, this is a while ago, but, like, I've had patients in the past who, kind of on the flip side, had, like, multiple carpal tunnel releases, but the problem was coming from the neck, and it wasn't until, like, 3 years later, 4 years later, they went and got a neck surgery that their symptoms went away.
Mm.
The surgery at the wrist actually did nothing for them, so there are, tests that, like, a hand specialist physician can order, it's called a nerve conduction velocity, NCV study.
Mhm.
It's not the most pleasant of tests, but basically they take some, like, fine wire needles and they send an electric pulse and they measure the time it takes for
Oh.
the pulse to get from point A to point B. And so if there's a delay in that, then they kind of suspect, okay, there's some kind of restriction or some kind of nerve damage in the way. Because nerves at the end of the day are just electric wires in our body.
Very interesting. We've got, give a couple shout outs. We have Brad Volgardson watching from Canada, from the Great White North, just above us, which would be that way for me, north, way
That's
north,
like
because
this
I'm in
way for me.
southern Arizona, way southern Arizona. I'm 2 hours from Tucson. And then we've got Lorraine Dawson from New Zealand, a Kiwi
Nice.
watching. Awesome. Love New Zealand. Lived in Australia for a couple years, not far away from there, and was part of the Sydney to Hobart yacht race in 2000.
Wow.
8 or 9, I don't even remember now. Yeah. Yeah,
Nice.
really
How
neat
fun.
stuff. Yeah, great country there. Um, and what we'll do is, for those of you who don't know, maybe this is the first time you're seeing our show. This is a once a month treat because Janice has lots of advice and can answer lots of questions about things that do affect musicians with repetitive motion injuries and drummers in particularly, of course. And next month, what we'll do is we'll address posture again, and we'll use your same software to show. Oh, Stephen says 2009. I think you're right, Steve. Our producer, Stephen, my son. We'll focus on sciatica. And
Oh, cool. That's a good one.
yeah, and you could show that. I had sciatica really badly for a while. I think I mentioned this on the show before, but not from
Yeah.
drumming and not from
Right.
bad posture from drumming, but I sneezed and bulged 2 discs in my back. And
Right.
it
Right.
affected me for a few years off and
Oh
on.
man.
And the funny thing is that maybe because I had such good height for my seat, for my body type and length of legs, that drumming was one of the only things I did where it did not hurt.
Nice.
Yeah, so that's kind of that'll be a fun topic because I
Yeah.
think so many people have had sciatica and it
Sure.
can be the worst and so painful, just
Yeah, it is
debilitating.
not a fun, I mean, none of these things are fun, but
Yeah, right. Yeah, I'm not
yeah,
sure. Lawrence S. Minor has a comment here. I'm gonna put it on the screen. Let's see if it
cool.
fits. It's a nice big comment. Says, I tried prescription meds for my arthritis. I tried them just for fun. No, I'm kidding. I'm kidding. For my arthritis and extreme pain, but it didn't work for me, which makes it even worse. Yeah, because it just masks it. It doesn't fix anything. Then he says, then I was recommended to a natural solution. I started microdosing on psilocybin capsules, and it started working well for me. I've been feeling productive. Cram spores on Instagram provided me with guidance. What's your take on that, Janice? And thanks for sharing, Lawrence.
That's awesome. Yeah, I mean, I also, I mean, the research is still out there, right? Like, there's so much that we don't know about the benefits of psilocybin. So, I haven't done a ton of reading, to be honest, on kind of all the pros and cons of it. But I know many people who have kind of taken the similar approach of like microdosing, but for different reasons, of course. And have like really great effects. So I don't really have a stance on it, either for or against. But I do know that it is out there, and that a lot of people have benefited from it.
That's great. Thanks again, Lawrence,
Yeah.
for sharing. One of the things I heard about psilocybin was, and the research is still out on this too, but I was shocked to hear that they were talking about it as a use against PTSD.
Yep.
Now, having tried mushrooms a few times way in my past a couple weeks ago, no, I'm kidding. It was it was decades ago. It was decades ago. But I was shocked that, like, I didn't have a bad trip or anything, but it
Right.
shocked me the correlation between that and PTSD. It just kind of didn't it was almost like someone saying, "Yeah, if you have sciatica, try the pogo stick. It's great for that." Like, it just didn't make sense to me because it's
Yeah. I mean, yeah.
psychotropic and you could fall down a deep rabbit hole of thought and whatnot. So if you have PTSD, I don't understand. I want to take some time, read up the research on that because
Yeah.
the curiosity.
I know people are like looking into it, like from the scientific world, they are looking into the effects of that. I've heard that as well. I have friends anecdotally who have like kind of gone through that themselves, who
Interesting.
like kind of swear by it. So I mean, it's the
Wow.
same kind of types of conversations that people had when they were starting to learn about the medical benefits of marijuana, right? So like, with THC and all that, all those components, how it
And
affects our
CBD,
body,
which is
and
non-psychotropic.
CBD,
Yeah.
exactly. So, like, you know, those effects is a little bit further along with like research and kind of learning about like the pros and cons of it all.
Mm.
So I think mushrooms are kind of going to be in that camp where we're just starting to kind of tap into and learn more about it, but this stuff has been around for eons, right? We're not like this is not a new technology or a new medicine. Like people have been
Right.
utilizing this
Like
for like
peyote and the
since
different
the
things.
beginning of time. So,
Yeah, and
um,
I've never corrected you on the show, but I just have to offer that mushrooms go on pizza and salad, but we're talking about shrooms, Janice. You know, one more interesting thing. I showed my doctor this. I have diabetes. I'm type 2 diabetes, and I take berberine, which is a natural herb supplement that does what they say metformin is supposed to do. And I don't take any prescription drugs for my diabetes. It's all diet. But I
I
take
see.
berberine, and then I started taking green I'm sorry, gold ang kratom capsules. And I noticed that in my daily regimen of taking those together with a couple other things that aren't related, my sugar numbers dropped so much that I had to back off. I went like down to 54 one.
Wow.
So I backed
Wow,
off.
that's really low.
Yeah. And I've experimented where I'll eat something I'm really not supposed to, like slice of pizza or a hamburger with a bun or something, carbs and sugar. And then I'll take two berberine, two kratom, and almost immediately my numbers drop back down. So
Hmm.
I'm kind of still working with it, but I showed him like a history of a week's worth of my readings. I wear a sensor, and any given time we'll do it just for fun. I can look at my numbers. It'll just Bluetooth automatically. And like
So
right now,
cool.
it's 162, which is in range for me.
Yeah.
Um, so I just find that really interesting that there's things that they find, like I'm finding, that isn't intended for that, but it seems to be
Yeah.
working for me. And that's a little high for me, even though it's in range. But I've
I
seen
mean,
it bring me down
those
to 104.
yeah, I mean, those CGM devices, like, think about how far that's come, like, technology that has come. Like, people can actually, without having to do, like, a finger stick after every meal or, like, before
Oh
they work
yeah.
out or anything like that, you can actually have, like, automatic information on how your body responds to different things, be it food or exercise or diet or sleep even. So it's pretty incredible, like what we have available at our fingertips these days,
Yeah.
where we've never even had that as an option before in the past. So hopefully with like more data like this, people can really start to capture like what's truly happening, not just like those points in time.
Yeah.
You can really
Absolutely.
zoom out and see the big picture of it.
Follow the trends and see the
Yeah,
whole, yeah. It's
yeah,
amazing.
yeah. So
Awesome.
cool.
Folks, thanks for following Janice Ying and myself on Drumming Injury Talk, which really covers a lot more than that. And we'll be back next month with a whole lesson on sciatica, how you can probably prevent it and how to deal with it if you have it. And we'll go through the anatomy of that with Janice's demonstrative software. And Janice, thanks for taking time. Appreciate
Yeah,
it
of
very
course.
much. Your expertise is
Always
always
fun.
greatly appreciated.
Always fun.
All right. Thanks.
All
Thanks,
right.
everybody. We'll see you soon.
See ya.